Hi, my name is Kaylani Hernandez, and I did my presentation on health literacy. So, learning objectives for this presentation are at the end of the presentation, the learner will be able to do the following. Viewers will be able to understand what health literacy is. Viewers will be able to explain how bad health literacy can impact a patient. And viewers will be able to discuss how nursing practice can influence patients with poor health literacy. So the first thing we are going to talk about is what even is health literacy. Schaub and Erb speak about how it is defined as the level to which patients are able to gather, process, and comprehend basic health information necessary for making appropriate choices about their health and treatment. So while a patient does all of these things to make decisions about their care, there are varying levels to which a patient is able to do this. There are also different things that can affect the levels of a patient's health literacy, or barriers is another way of saying that. To name a few, some could be reading level of the patient. Like most patient education materials are supposed to come in a 5th grade reading level. The language, if a patient's primary language is not English, maybe it is Nepali or Spanish. Another one is is your patient in pain? Are they comfortable in that moment completely to be able to process that information, learn, and truly understand? Now, let's move on to the topic of how health literacy plays a role in nursing practice. One of the most important jobs as a nurse is interacting with their patient in patient education. So there are lots of things nurses have to consider when practicing to make sure that their patient has an appropriate level of health literacy in order to understand what is being taught. Taylor and others go over a couple key points when assessing the learning needs of patients. One of them is actually assessing the learning needs of your patient and not just assuming based off the looks of the patient, or even if the patient can read and write basic English, you should still not assume then. Taylor and others also talk about how various patients can have various learning disabilities. Some of these disabilities make it harder for the patient to simply understand written material. They also made a point that a nurse cannot assume that they have any prior knowledge on a subject because oftentimes the material needs to be taught over and over in order to stick with the patient. Another great point made by Taylor and others is that involving the family could help. That way, there is more than one person learning about a patient's chronic condition, for example, and could possibly help in managing it. That is, if the patient allows and has the family there to help. Now, how does low health literacy impact healthcare? Cardoso and others talk about the impact, but also the barriers that could lend a hand to low health literacy, which is important to cover. The strains on healthcare is a pretty broad topic. There are many strains on healthcare professionals, from staffing shortages to increased census and increased security. This leads to healthcare professionals maybe not having the time to cover the material in a slow enough manner that people with low health literacy need to understand. Inadequate patient education materials is another barrier brought up by Cardoso and others. This could maybe be the discharge instructions do not come in the patient's primary language, or maybe healthcare facility does not have other ways to show and educate the patient other than written material and verbal instruction. Some patients do really well with tactile experience and would do well with learning that way. Many articles did speak to healthcare professionals assuming that a patient has more health literacy than they actually have. Schaub and Erb state that 1/3 of adults are categorized as having basic or below basic health literacy. The consequences to this, where patient healthcare is involved, is barriers to adherence, impaired adherence, according to Cardoso and others. This makes a lot of sense because how is a patient supposed to follow health directions that they did not necessarily even understand? But this could be a big issue for patients trying to manage chronic conditions on their own. Now that it is clear that low health literacy impacts an individual's healthcare, let's speak about how low health literacy of the population can impact society. Schillinger states that some points about what low health literacy can lead to. One of them is increased emergency room visits. There are many reasons we are seeing increased emergency room visits today. Low health literacy is definitely playing a role in this. In our last slide, we talked about how it can affect treatment adherence or create barriers. If these patients are not adhering to their treatment regimens, they're going to create exacerbations where their chronic diseases are concerned, thus increasing not only emergency room visits but hospitalizations as well. This is a big problem that hospitals nationwide are seeing: increased hospitalizations and limited room. Poor doctor patient communication is another consequence Schindlinger covers. This seems like a vicious cycle, sort of, because if low health literacy affects doctor patient communication, then that further leads to low health literacy. Schindlinger also writes about how low health literacy increases excessive health spending. This makes sense due to the increased emergency room visits and hospitalizations. Finally, Schindlinger also covers increased rates of chronic diseases. For example, I would like to cover type 2 diabetes. Low health literacy could be detrimental to the pre-diabetic patient who is receiving care from their PCP and maybe not understanding to the fullest extent how their lifestyle choices are affecting their health. When the patient continues on the way they're living and then develop type 2 diabetes, their low health literacy can help contribute to that. There's a very specific example that I just said, but this could be applied to other chronic diseases as well. Health literacy is a very important part of healthcare. Nurses are the driving force for patient education at the bedside, so making sure that we as nurses are providing the education to the patient in a way the patient understands is arguably the most important part of providing that patient education. Low health literacy affects not only the patient but society as a whole, from increased chronic diseases, as previously mentioned, to increased healthcare spending. So assessing our patients' health literacy and providing education in a way that they understand can help us to make a big impact on this issue. Thank you for listening. Here are my references. The picture that was used was from Pixabay and do not have any owner rights.